Thank you for joining us. I'm Dr. Evelyn Gomez, Program Director and Associate Professor, Dr. Angela Fauchier, Associate Director, Emily Stern, Program Coordinator, and we are part of the Trauma Responsive Implementation and Practice Program at the Kemp Center. Our program's vision is to create evidence-based, culturally informed, and trauma-responsive system change, which will support healing and resilience. And our mission is to empower individuals, organizations, and systems to strengthen and support the integration, implementation, and dissemination of trauma-responsive and culturally appropriate practices. Through organizational and system improvements, we support families and individuals as well as enhance workforce capacity. The areas of focus of our program is on implementation and dissemination of evidence-based and trauma-responsive practices with various systems and organizations. We provide technical assistance, consultation, coaching, training, and education, and we emphasize evidence-based implementation, dissemination, and research. Our program began in 2008, implementing trauma-informed treatments for children and families involved in child welfare. In 2011, the Administration for Children, Youth, and Families awarded our team one of the first grants in the country focused on creating a trauma-informed child welfare system. This ACYF project was in partnership with Denver Department of Human Services and 24 behavioral health agencies. And we had three main priorities: implementation of a universal trauma screen for children involved in the child welfare system, comprehensive workforce development and training for child welfare staff and their partner systems, and training of mental health providers in two evidence-based treatments: child parent psychotherapy and alternatives for families cognitive behavioral therapy. In 2017, we partnered with the Behavioral Health Administration through a SAMHSA grant. This is a funded system of care grant, which focuses on trauma-responsive practices as well as implementation of high-fidelity wraparounds statewide. As a result, we also created the Colorado Cross Systems Training Institute, where we train professionals around the state, and you can see the growth from 2018 to 2022. The Colorado Cross Systems Training Institute is managed by the TRIP team. We also develop curriculum for the Colorado Cross Systems Training Institute of the Behavioral Health Administration for workforce development. Professionals can access CSTI to improve quality of care for families and children. We develop various trauma-informed curricula disseminated through CSTI. CSTI has over 175 possible training hours for professionals through a combination of web-based and instructor-led trainings. And professionals taking these trainings come from various systems in various parts of the state. The TRIP team has worked with various systems throughout Colorado and beyond, including education, early childhood, mental health, justice, child welfare, healthcare, and human services. Our aim is to enhance knowledge of trauma-responsive practices, transfer knowledge into day-to-day practice when working with children and their families, and increase the resilience of the workforce, improvement and enhance organizations' use of trauma-responsive and culturally responsive policies and practice. The well-being, knowledge, and skills and competence of professionals is crucial to the healing, safety, and empowerment of children, youth, and families. And you can see how professionals working in this field work with children all over the state of Colorado. Our current partners involve Behavioral Health Administration, school systems, University of Denver, Child Welfare, the National Association of Counsel for Children, and other community organizations, especially focused on Spanish bilingual communities. Our current projects involve projects with Behavioral Health Administration, the University of Denver with a newly funded grant, Denver Recast, another SAMHSA grant, the Family First Prevention Services Act, and we serve as the intermediary for PCAT and implementation of evidence-based trauma treatment for parent-child interaction therapy and implementation of trauma responsive practices in school. Thank you for watching, and if you have any questions, please reach out.